Hi, everyone. Thank you for allowing me the opportunity to present. My name is Pragyan Khanal. I'm a research associate at iReach at ChristianaCare, and my research areas are centered around geospatial applications and using spatial methods to enrich clinical EHR data by better understanding the built environments in which our patients live. So this work is looking at the spatial variation of COVID-19 hospitalizations by disease severity at ChristianaCare. It was done in collaboration with Frank Carriero, who's a professor of epidemiology and the director of the Spatial Science for Public Health Center at the Johns Hopkins Bloomberg School of Medicine, and Alicia Salvatore in her role at ChristianaCare as director of community engaged research. So a little bit of background. COVID severity can be characterized by a score provided by the WHO, ranging from 1 to 10. If patients were hospitalized with COVID, they were assigned a score of 4 or greater, depending on oxygen levels and the level of oxygen support needed. So a score of 4 to 5 corresponds to moderate disease, 6 to 9 corresponds to severe disease, and 10 is an indicator for mortality. So the question we asked was, how does the spatial distribution of hospitalized patients with more severe COVID infection compare with that of patients with less severe infection? So our aims were to characterize the spatial variation of patients hospitalized with severe and with moderate COVID infection. This was done through maps of estimated spatial intensity. And then we wanted to compare the large-scale spatial variation and small-scale spatial variation between the two groups. So this is done at the large-scale level with a map of the ratio of estimated spatial intensities, and then at the small scale by looking at a difference in K functions plot. And then we wanted to compare the clustering of severe COVID around hospitals versus the clustering of moderate COVID around hospitals, and this is done using a difference in cross K functions plot. So our population was just over 6,300 patients, all with Newcastle County home addresses that we geocoded. They were hospitalized between March 2020 and March of 2022 and admitted to either Christiana or Wilmington hospitals. And we examined the first hospitalization if there were multiple if they were hospitalized multiple times. And COVID-19 disease states, we looked at the maximum WHO score during their hospitalization, characterized severe as that 6 to 9 grouping and included the 10 for mortality, and the moderate was the same, 4 to 5. So patients with severe COVID hospitalizations were on average about 5 years older, were more likely to be 65 or older, male, white, have Medicare insurance, and had on average just over 0.6 additional comorbidities. So the map on the left, so this shows the estimated spatial intensity of severe COVID hospitalizations throughout Newcastle County, and the right map is the spatial intensity of those with moderate hospitalizations. I included the two black dots or the locations of the two ChristianaCare hospitals, and then included the census tract boundaries just for spatial reference. The spatial intensity maps characterize large-scale spatial variation and are estimated using a kernel density approach. So the study area is divided into just over 16,000 pixels that correspond to a 128 by 128 grid, and intensity is estimated at each pixel. And a bandwidth of 2 kilometers was selected just based on sensitivity checks, looking at the point locations of the patients, which obviously can't be displayed here due to HIPAA protections. And in both maps, we see that spatial intensity is highest near the city of Wilmington and in a band that kind of extends from the Claymont area through Newcastle and then into parts of Newark and Bear. And it's lowest in the southern half of the county. So the map here shows the estimated ratio of spatial intensities of severe to moderate hospitalizations. And the contours here correspond to a two-tailed p-value of 0.5, or 0.05, sorry. The ratio of severe to moderate hospitalizations ranges from 0 to about 3.7, and ratios over 1 correspond to a higher number of severe hospitalizations than moderate. The contours are based on about 1,000, Monte Carlo random labeling simulations of all of the COVID hospitalizations, and they highlight areas where the ratio of spatial intensity shows significantly elevated or severe hospitalizations in red, and then in blue are areas of significantly lower risk for severe hospitalization. So the risk of severe hospitalization is significantly higher in areas around northern Newark, Pike Creek, and Hokeston, and in North Wilmington along 202, which is the census tract boundary that kind of divides this North Wilmington boundary, and significantly lower within the city of Wilmington. There are a few smaller pockets in the southern half of the county that showed significantly higher or lower risk of severe hospitalization, but this should be interpreted with caution. The sample sizes there were a little low. So the K functions, so on the left, K functions are a way to characterize small-scale spatial dependence or clustering. They are a function of distance and are individually calculated for each of the outcome groups. So here we look at the difference in K functions between severe and moderate hospitalizations, and the baseline level of clustering is set as the clustering of moderate hospitalizations. So the red lines are minimum and maximum differences, representing a significance envelope based on 39 simulations of Monte Carlo random labeling, and the blue line at 0 is the null hypothesis that severe hospitalizations don't cluster any more or less than baseline moderate. So we observed that within 7.5 kilometers, moderate hospitalizations cluster significantly more than severe hospitalizations and continue to do so at larger distances, though not significantly. On the right, we look at a difference in cross-K functions. So cross-K functions are a way to characterize clustering of outcome groups around specific events, such as the two ChristianaCare hospitals, and are a function of distance from the events. We observe the difference in cross-K functions describing the clustering of severe hospitalizations around hospitals compared to the baseline clustering of moderate hospitalizations around hospitals. And the red Monte Carlo lines and the blue null hypothesis lines are the same interpretation. And here we found that moderate hospitalizations tend to cluster more around the two ChristianaCare hospitals than severe hospitalizations. And this difference was seen up to about 15 kilometers, but only significant at some of the smaller distance interval levels. So analyses so far have only shown some large-scale spatial trends and not so many significant findings on the small-scale spatial dependence side. The work is still ongoing, and our next steps are to better understand what factors account for a location being possibly a severe hospitalization versus a moderate hospitalization. And this will involve running logistic regression models with covariates such as age and individual comorbidities that are associated with COVID-19. And we can look at the spatial variation of the logistic regression models, standardized residuals, and compare that of a model without covariates to be able to identify the covariates that might help explain some of the spatial dependence that we see. So thank you for your time. I look forward to continuing work with the GIN, the Delaware CTR, and the Bird Corps and welcome any opportunities to collaborate on projects with spatial applications. And my contact information is here.